Hi, and welcome to today's episode. If you're new here, I'm Christine. I'm a feeding therapist, and I help parents of picky and actually very fearful eaters go from really stressed, stuck meal times to confident, calm foodies. We use a very holistic approach here. We look at the whole child and we really uncover everything, leave no stone unturned. So, if you're tuning in today, today's episode is actually a story about how I got something very wrong in the past when it came to a client and what it taught me about eating and also a little bit about autism as well. Nothing that I didn't really know about autism, but the connection that I had missed before. And even if your child doesn't have autism, I think you're going to learn a lot from my mistakes here. So, it's hard to admit when you make a mistake. Nobody likes to be wrong. Nobody likes to, as a therapist, you get into a line of work to make progress, make a difference in a positive way. So nobody really likes getting things wrong, especially when it comes to helping other people and helping other people's children, right? So it's hard to admit, but years ago, before I was really a true feeding therapist, and what it's become today, um, I was handed a feeding case, as so many therapists are. You know, um, we're not trained specifically to treat any one condition in our graduate school, kind of like, a doctor's side. It's kind of like they learn about a lot of different conditions and how to treat a lot of different things. Um, and there is no special schools or specializations like how a doctor will go to cardiology or to GI and they'll specialize. Of course, therapists can specialize, but there's nothing that really mm, dis- distinguishes us from one another. We know our training, but as the consumer, as the parents, you guys don't. So I think that's a really big failing of the therapy world, that parents don't always know who the best therapist is for their child's condition, because there isn't a great way to tell unless you're really smart and astute and know to ask those questions. But most people, they just assume, like, okay, well, they said to find a feeding therapist. They said they were a feeding therapist, or they said to find an OT. This person's an OT. Like, it's just more general, right? So I was handed a feeding case and I felt like I could handle it. It wasn't like anything too crazy. Um, and this case was a girl with autism. And I had had a tremendous amount of experience with autism. I worked at a school exclusively for children with autism. It was like a very special private school in Manhattan. Um, and what I sort of ended up labeling this as a behavioral feeding issue. And I totally missed the real reason that this girl was struggling to eat. So I'll tell you about it. Right. I said I was working as a therapist in the past. I've worked in many settings, but one of them in particular, I worked in this, I don't know if I'd call it like a fancy school, but it was like a very special school in Manhattan for children with autism. It was what they coined as like an ABA style school. So they were just basically ABA therapists, and then there's speech and OT therapists. But everything was done with that behavioral approach in mind. So I had a really strong background in this, and I felt like I could really apply what I had learned there to this case. I actually thought it would be pretty easy. And I was applying it, and wasn't going terrible. But like I said, I was given this case. She was refusing to eat lots of different textures and foods. And how she even got feeding therapy, through the school district was like another story, because usually districts don't like to give feeding therapy. They will sometimes, but it really very much depends. Um, so I leaned on what I knew, which was these behavioral tools. And that's what every therapist does. That's why training is so important because, well, what one person is trained in is different from the next, and it will totally inform and direct how they do therapy and what type of therapy and what approach they use, right? We're not all trained the same at all. Okay, so I basically ruled out oral motor issues just because, looked like everything was good. She had teeth, she had a tongue, she could talk, she could open her mouth, she moved her tongue from side to side. I thought it was an open and shut case. Obviously, there was nothing wrong with her mouth, right? And I've seen that so many times. I've gotten reports that say, oral motor structures are within normal limits. Um, and there is no description of any of those structures. So I know that that therapist probably just, unfortunately, just didn't have the training to complete a true oral motor assessment. I didn't really consider her sensory needs. I knew children with autism had sensory needs, but I didn't connect that the sensory was with the food at the time because I hadn't been trained to look at it in that way just yet. So, what I tried, it it helped to a certain degree. It helped while she was getting reinforced. It helped while I was there. Um, it carried over a little bit to the home, but it didn't end up making her love food, right? And that's the big difference is that she was eating because she knew that she had to, because she knew that basically this is what was happening. Like she was going to get reinforced for eating the food. And even though she was still gagging, we kind of moved past it as if like that wasn't happening. Like that was just a behavior she was experiencing. And, I just kind of pretended like it wasn't happening, which really honestly makes me sad even to this day that I didn't look further into it. But again, it's like you only know what you know. I just didn't know to look past that behavior. I just assumed that it was a behavior, I should say. And I didn't look further as if it was she was having a sensory reaction to the food, which I now know that that's what was happening. And it was probably because she probably didn't have the best oral motor skills, right? She was like a little bit low tone, and since she wasn't chewing lots of different textures, she definitely did have some much muscle atrophy. I just didn't know and I didn't see it at the time. And in retrospect, looking back, that's what I could see. Um, you know, so she definitely felt pressure when I was there. Um, Sometimes she would avoid, some days she just really didn't want to do it, but we really stuck to that schedule. We stuck to that token board. She was going to earn. Okay, she doesn't want to earn this today. I guess she's being a little difficult. We better think of something else that she really wants even more. So it became more about, well, maybe we just didn't get the right reward today. We'll switch up the reward, right? And that's the opposite of how we do everything now. Um, at the time, I felt like I was doing the best job that I could be doing. And I actually felt like we were making some progress. Even though she was still gagging, she still didn't move food around her mouth great. Um, she was complying. So on the surface, it looked like she was making progress because of her compliance, right? Um, Looking back, I obviously can see that this was not a behavioral issue. I don't think I've ever had a child with autism where feeding became a behavioral issue. There's always that sensory component, that oral motor component. Um, so I missed the root cause totally, right? Um, you know, um, Many kids with autism, they're not misbehaving when it comes to food. They're just overwhelmed. And a lot of times, even with those oral motor skills, just incapable of some of those harder textures like meats and vegetables that require more chewing endurance, that require more oral motor skill. And these sensory and oral motor delays, they're just often overlooked, just like I overlooked this little girl's issue. And I just took it as she's just being behavioral. She's just gagging because she doesn't want to be here. I wasn't I wasn't really looking closely enough. Um, mislabeling it as a behavior really delays progress. And it probably hurt my trust. It probably hurt her trust with food and with me. I just couldn't see it. So when I was done with the case, you know, I don't know what always happens after you're finished with the case. So did she regress? Did she continue to eat? Did she continue to gag even to this day? I don't know, unfortunately. Um, but since I've trained in this now, I've shifted completely and I definitely have a more holistic lens. So if you've been told like it's just behavioral, just keep asking questions. I'm not saying that they're wrong, but there might be more to it, like there was in this case. It's okay to ask for a second opinion. And if you're a therapist listening to this, I hope you give yourself grace too. Our training gaps are very, very real. But they don't have to define your future. You can learn more, you can grow as a therapist. So if this is you, if this resonates at all, love to hear from you. And if you feel like you do need that second opinion, of course we're happy to help with that. But remember, you just got to keep asking questions. Is the person you're going to really well trained in those 4 pillars of feeding, which is sensory, oral, motor? Mindset is a big one too, in gut. Okay. And you want to look at the nutrition as well. So we do help with all of that. You could visit the pickyeaterstest.com to see what type of issues your child is having with food and learn more about what we do. But we will see you in next week's episode.
Thank you for listening to How to Unpicky Your Picky Eater. To learn more about achieving your child's feeding goals, check out Christine's website at foodologyfeeding.com. And be sure to tune in next time to How to Unpicky Your Picky Eater.